Hello. Hi friends. Welcome to another episode of Learn with Flo. If you are new here, I'm Lauryn Moore, owner and founder of The Lowdown. So I'm so excited to welcome to you guys to another episode. This is our weekly opportunity where we take every Monday to have a little bit more of a long form sit down content to be able to talk about some very relevant topics in the world of health and nutrition, functional medicine. And today is going to be no different because I want to continue all this conversation we've had around this hormone hierarchy, right? So we've gotten to really talk about one of the biggest gaps, I think, in the world of just conventional medicine, but also especially functional medicine, is looking at things from a more specialized lens, right? Very niched down. And that doesn't really do a lot of people a whole lot of service when it comes to understanding the body as a whole, right? A whole system, an interconnected unit. And unless we really understand how to zoom out and kind of take care of the body in all of its different intricate parts and pieces, usually we leave results on the table, right? We leave some things to be desired in that regard, right? And I just love this opportunity to kind of talk with you guys in this format, more of this longer form, call it kind of like webinar, podcast style, because I think there's so much nuance in this space that it's hard to, and I mean, not even just hard, it's literally impossible to talk through all the potential scenarios in which someone could navigate this world, even if two people have the exact same symptoms, that could be two very different root causes, right? And so I was talking to one of my current one-on-one clients this last week, and she made the comment, we've been working together for about 6 months now, and she made the comment to me last week, and she was like, I love what you do and how you do it, because you're the first health provider that I've ever worked with that has actually educated me. And you support me in helping me implement those changes in more of an easy and motivating way, because now I know and understand the why, right? And that's something that I just like instant happy tears, right? You want to like fill my heart up is like, give me a compliment like that, right? Because that's somebody that has really kind of recognized it means that a lot of my passion and style is authentic, and it shows, because that's really what I really love to do, is just educate and come at it with a really strong empowerment piece, right? The more you know, I feel like the more we can navigate this world without a whole lot of confusion and without a whole lot of overwhelm. It just takes someone teaching us how our bodies actually work, right? So to any patients and providers that are out there listening to this, like that comment, that compliment right there, like that is the magic, right? That is the magic where we get to really see this practice, or at least my practice of what I consider functional medicine, is always thinking about the holistic piece, like whole as in WHOLE, right? Like this holistic picture, because I found it to be vitally important that we're bringing all of these systems together, fully knowing that in a disease state, it occurs when the body is separated. All of these parts and pieces have lost communication with each other, right? Somewhere from the mind to the body to the spirit, we're seeing disconnection. And that's why people are failed time and time again from a more like niched and specialized medicine. I'm not saying that there's not a place for it, because there absolutely is. But I think more so often than not, especially when we're dealing with more chronic conditions, chronic disease, or we're dealing with individuals where it's not an emergency situation, we're not dealing with like a life or death scenario. It's more so someone that's not living optimally, not living fully functionally in their world. And we have a lot of providers now these days that are really just niching down into this specialized medicine, and they're kind of coming at it as like, well, I treat the eyes and that's where I stop, right? Or I treat the colon and that's where I stop, or I treat the heart, but that's where I stop. Or like what we'll talk about today is I treat the mind, but that's kind of where I stop, right? And there's just no root cause medicine this way, right? And it all goes back to what I've been discussing with these higher level systems thinking analogy that we really need to apply, in my opinion, to patient care, because it's working to connect the body, right? It's not about taking all of these different lab markers and you have blood sugar over here and thyroid over here and your gut and your liver and your sex hormones and perimenopause and menopause and libido and body composition. It's like, great, you're one person. how are we treating like the holistic system in the right order of operations, which I call the hormone hierarchy, right? So I truly believe this is what sets me and the low down methods apart from other kind of functional medicine providers, as well as definitely the traditional medicine model as a whole. It's that important, right? To bring unity back together to all these different parts and pieces, not treat them as these separate entities and these kind of separate specialties and these separate niches, right? That's, I think, the big wave in healthcare that people are looking for and seeking is providers that can educate them, that can help them feel like they are the ones in the driver's seat of their health outcomes, and also someone that is a powerful advocate for them in all of these different avenues of really systems thinking the body, not separating it into more parts and pieces and expecting success, right? And when we talk about this separation model of healthcare, I think one of the biggest places we end up seeing this is separation of the mind and the body, right? Especially when we've not only has this created like a crisis in our physical health, like our body health. I mean, look at the current statistics right now, quote, how 88% of our current American population meets the criteria for what we call metabolic resistance, or aka metabolically unhealthy, right? High cholesterol or high triglycerides, or struggle with blood pressure, pre-diabetes, right? All sorts of different things that really, like, physically, we're definitely seeing the ramifications of this more separated healthcare system. But also a severe mental health crisis because of this separation analogy as well too. Today, I just, these statistics I just have to share with you guys because I just think they're mind-blowing, right? Today, 45% of people 45% of people report experiencing persistent feelings of sadness or hopelessness. That's 45%. Now in 2011, that was 28%. So it's almost doubled, right, in the last 10 to 12 years of individuals reporting definite symptoms in their overall mental health and well-being. Also today, 23% of the US adults, which is about 59 million people, experience some sort of mental health condition. They have been diagnosed with some sort of mental health condition, whether it's anxiety, depression, postpartum anxiety or depression, OCD, ADD, ADHD, right? And that's just 23% of US adults. That statistic doesn't even account for our pediatric population, right? Add that together, wild, I'm sure. Or how about the 38% of people that are in mental health care in general since the onset of the pandemic than ever before, right? So before the pandemic, it was about, at least these statistics that I was able to find, it was about 18%. And since the pandemic, it's gone up to 38%. What? Like, that's crazy, right? As of 2020, even some really sad and startling statistics of suicide being the second leading cause of death in kids aged 10 to 14, right? So we see this mental health crisis across all age spans, right? And it's the hardest part, I think, for us to kind of talk about and recognize is that we seemingly have more tools available, but the statistics are not going the right direction. So to me, I'm like, something's missing here, right? Where our approach has to have some holes in it. It has to have some gaps. It has to have some missing links, because otherwise you would think people having more access to mental health practitioners, mental health resources is really the original word I was looking for, more mental health resources, you would think that those statistics would be going the opposite direction. So that's where I want to kind of come in today with a better understanding amongst this hormone hierarchy, right? We're putting the holistic body back together again and treating it as a whole. Where does mental health fit into all of that, right? And that's what I want to talk about today. So even without any formal diagnosis or treatment, we discussed last week how to identify someone that is in a state of, like, these early states of fight or flight, or these early states of mental distress, right? We talked about that last week, where you can quickly identify that. If you missed out on that, the 3 biggest clinical pearls that you can use to recognize somebody that is already in one of these more stressed mental health states. Someone that, number 1, has nervousness or anxiety about their body. Number 2, nervousness or anxiety about time, or nervousness and anxiety about their environment, right? And so we're out here running around with our heads cut off, trying to do all of these different things as a fix for either our body, time, or our environment, right? We see it all the time. People that are, dieting, or they're binge eating, or they're always looking for the next anti-aging thing, or they're nervous about time. It's never the right time. There's never enough time, right? Or nervous is about their environment, and they feel like they're going to relieve those feelings of stress and anxiety by getting a new car, getting a new house, getting the new handbag, getting the new shoes, keeping up with the Joneses, right? It's like we see this every day in our society, and I think it's even more prevalent because we don't know how to recognize it, don't know how to talk about it, and we certainly, to me, don't have enough of the right approaches and resources to be able to help people navigate through this experience. It's like this is outside of like the physical health, but it shouldn't be. Right? It's like we're creating this huge separation between mental health or mind and body. And the solution is uniting both of those things back together. So a lot of traditional psychotherapy approaches use things like medications as a lot of first line treatments for things like clinical depression or general anxiety, which a lot, if you go back to like the research where they use your double-blind placebo-controlled trials, which is considered the gold standard in testing a lot of these things, a lot of those drugs have not been found to be any more effective than a placebo. Nobody tells you that, but it's very, very similar to someone thinking that they're on some anti-anxiety medications and the power of the mind, right? So it's like, why are we not joining these two back together? Why do we continuously try to separate the mind and the body? And so that's what I really want to talk about today when we're talking about this hormone hierarchy, and we're talking about things like our relationship with food, and we're talking about things like our relationship with our nervous system and fight or flight. I think it's very important as we move our way through this hormone hierarchy. You're noticing like, I can't even talk about hormones and gut health and liver and thyroid function unless we talk about these things, right? These are the dominoes that are going to hold a lot of people back from getting that more holistic healing that they're looking for. So today, let's really dive into, I wanted to talk to you guys through what I call the low-down approach to more mental health disorders. I am not saying that I am a psychotherapist. I am by no means a certified mental health professional, and I would absolutely love my community of network that I use very frequently to create a more integrated model. So those are other therapists and mental health professionals and counselors that I work with who appreciate the both, right? We're sitting here as two different practitioners, but understanding how a lot of our patients need both. We can't just separate mind and we can't just treat the body. We have to unite them both back together again. And that's really where more of an integrated approach comes in, right? And if you haven't been part of this integrative approach, that's where, and maybe you've just been treating your mental health separate from your physical health, I want to pose like maybe some tough questions to you that maybe you haven't asked before. Or if I have any mental health professionals that work in this space that haven't really thought about this, I'm going to ask you guys kind of some tough questions that I feel like are absolutely going to need to be kind of part of that forward thinking wave of helping individuals treat mental health conditions a lot more effectively. So the tough question, number 1, has your doctor or provider who prescribed you anti-anxiety medications, have they educated you first about how things like blood sugar fluctuations actually also feel like anxiety and panic attacks, and also can exacerbate or even cause anxiety or panic attacks? Because if they haven't, then again, they're kind of doing you a disservice. Like, where's the integrated model there? Or has the provider who prescribed you sleep sedatives, have they educated you first about how things like beneficial bacteria in the gut are required to actually create these key neurotransmitters that travel to the brain and regulate things like mood and sleep? How about the therapists that you've been seeing they listen to a lot of your trauma and all of the things that you're going through, but have they educated you first about how the presence of things like even pathogenic overgrowths in the gut can cause major depressive symptoms and exacerbate OCD, ADD, ADHD type of tendencies, right? That's what I mean when it's like a mind-body approach, right? Are we talking about things like blood sugar? Are we talking about things like the gut microbiome? Are we talking about things like nutrient deficiencies and neurotransmitters? Or are we just talking? Right? That's kind of where I think the disconnect comes in, is that usually it's an and both type of a model that tends to get people the most success. So to me, the missing link in this mental health crisis is really bringing the physical body back online with the mental body. Right? So research strongly suggests that there's a clear connection between the gut health and mental health. And that's just some of the things that I want to highlight for you guys today. I think we know a lot of people have felt the benefit of utilizing, like I said, some mind therapies, whether it's talk therapy, in those situations, but maybe they haven't really equated that there's probably also a physical body component that's going to bring that transformation full circle. Right? So when I talk about this, I just want to more than anything, like bring it to light, bring it to the masses so that you guys can start to see and appreciate even some of the things like that I do behind the scenes when individuals come to me and they're like, I'm struggling with anxiety. I've been diagnosed with ADD or ADHD. I've been put on, Ritalin and Adderall, and I'm taking a lot of these, stimulant type medications to help calm me down, or I'm on SSRIs, right? It's like, how are those things that I do within my side of things help bring the physical body back online to that? Because there's probably some underlying physical things that are part of this equation too, right? So the gut is often referred to as the second brain for a reason. It plays a crucial role in various bodily functions, including digestion and metabolism, even the making and synthesis of essential molecules like neurotransmitters and even hormones, right? So to me, the lowdown model towards mental health is more of an integrative approach. So number one, are we surprised? Food is always the first stop to me when it comes to mental health management. And that's, like I said, just to share some statistics with you guys again, because this isn't just me saying this over and over again. It's like, well, of course she would say that because she's a nutritionist. And of course she's going to say that food cures all. No, I do not say that. Food does not cure all. Food is definitely part of the prescription and a key part of the treatment plan though. And without it, we can't really move forward without some foundational pieces, right? And why is this so key? Let me share a few statistics with you that I think are helpful. A 2022 meta-analysis actually found that greater consumption of ultra-processed food was associated with increased bouts of depression and anxiety symptoms. Are we surprised? No. But ultra-processed foods make up 60% of the American diet. So it's like, we can't just ignore this like correlation and causation between these two things, right? And a lot of people, like I said, don't even really always understand exactly like what an ultra processed food looks like. It's more so just the farther away you get from being able to pull that food straight out of nature, it goes through processes, right? So the farther that thing looks like from a banana that you could pull off of a tree, or a tomato you could pull off of a plant, or a potato you could pull up out of the dirt, the farther it looks away from that, the more ultra processed it is. So you can start to appreciate how the standard American grocery store is pretty much a lot of ultra processed options. And if that's a big part of your day-to-day routine, then you may not make that correlation to that and your mental health, right? So that's something that we need to definitely think about and correlate. Like food quality is one of those things, right? A 2017 study looked at the Mediterranean diet, which pick one, right? I mean, it's not just like, oh, she's team Mediterranean diet. It's like, no, they just chose the Mediterranean diet. And this one happens to be high in things like omega-3s, happens to be high in things like healthy fats, things like vegetables, a lot of seafood, right? It doesn't have as many of the high sugar, high carbohydrate density. So they just picked a Mediterranean diet, pick one, right? And they happened to look at this in individuals that suffer from major depressive disorder. They found that 32% of the participants in this study achieved full remission of depressive episodes within 3 months of starting that intervention tool. 3 months of starting just the Mediterranean diet intervention tool and major depressive episodes. Like, talk about like low risk, high reward type of intervention strategy, right? And the last one I'll talk to you guys about here when it comes to nutrition or food forward and why I'm so passionate about that when it comes to a mental health integrative approach. A 2015 study suggested that get your words, Lauren, repeated episodes of hypoglycemia actually increase the likelihood of anxiety, and that type 2 diabetics are 2 to 3 times more likely to suffer from anxiety than non-diabetics. So we know that there's this correlation between blood sugar and anxiety. Chicken or the egg? Well, a lot of times, like, you're diagnosed with diabetes and then you might have anxiety, or you might have anxiety and then get diagnosed with diabetes. They cannot be separated. They're one and the same. It's one body. But we have to at least understand and respect that if we're not thinking about teaching people how to fuel in a blood sugar balanced way, we're not teaching individuals what it looks like to have, like I said, a understanding of food quality, of course we're going to have a continued mental health crisis, right? And that's something that no amount of advancements in medications in the world can change that, right? And to me, knowing some of these statistics, I'm like, why is this not part of the standard treatment? I'm not saying that everybody that goes through mental health treatment is going to be open to nutritional changes, and that's fine. But I'm talking about the people that are, and the people that just aren't getting offered or provided this type of approach with it. And lots of people, even people that come to me, they would rather treat a lot of these things without medications, right? And they're just not given a lot of those conversations. A lot of times, if they are in front of a prescribing provider, that prescribing provider might be mistaken and not understand this information and might tell them that food doesn't matter. And might tell them, oh, your nutrition, it doesn't matter. Or they might do a quick food recall with someone and they're like, and someone doesn't really have a great accurate representation of really what their diet consists of or doesn't consist of. I mean, how many people are going to be in a doctor's office and the doctor's like, do you eat enough protein? And they're like, no. I'm like, of course, most people think that they eat enough protein, or most people think they get a large amount of vegetables or plant matter in their diet. And most people probably just don't, because they don't understand like what that actually looks like, right? We haven't been educated. So that's just my big part. Number one, phase one of like an integrative mental health approach to really bring the body and the brain together back online. We have to think about food. It doesn't have to be perfect. You're still going to enjoy your favorite stuff, right? Anybody that's worked with me knows that there's no foods that are off limits. It's like all foods fit. They just have a space and a place. And the more that we understand those and bring a really solid, like neutral and educated and confident relationship to the table, we good, right? We can navigate the standard American food system, no problem, regardless of your family, your budget, where you grocery shop or anything. You can have a sound strategy. Trust me, I've worked with all shapes and flavors, right? So when we think about food being the number one stop, the second stop that I wanted to bring some more attention to, because again, just don't feel like there's enough information out there, is the role of gut health. I do absolutely believe that this is the next part of an integrative mental health strategy that, again, is not talked about enough. So the gut microbiome, that whole living, breathing ecosystem down there that's full of bacteria and fungi and protozoa and all of these different things that live in our gut, they influence the brain in several ways. Number one, more of an immunoregulatory pathway, meaning that there's specific gut microbes that actually impact and affect our immune system cells, including those of the brain. Yes, our brain communicates with the immune system. Wouldn't you know, right? Also, that can influence through what we call a neuroendocrine, excuse me, what we call a neuroendocrine pathway. So we have certain gut microbes that can affect the production of certain amino acids, which then go on to make things like neurotransmitters. One of those specifically being things like tryptophan. which goes on to make neurotransmitters like serotonin that impact mood, and serotonin gets converted to melatonin, so it impacts sleep, right? Also, if there is any sort of gastrointestinal irritation, inflammation going on in the gut, that can send a lot of signals to the brain of stress, right? A lot of mood changes can result of that. We also see changes in appetite because of that as well too. So stress and inflammation go very closely hand in hand, and a lot of times those sources of inflammation are actually coming from the gut, right? So a lot of different things can happen. There's certain gut bacteria that are called what we refer to as LPS producers, or lipopolysaccharide producers, which is a form of inflammation that can cause things like leaky gut to occur, which then can progress into autoimmune patterns. So yes, there are certain bacteria in your gut that exacerbate those autoimmune progressions. We also see things like yeast, fungus, mold overgrowth that absolutely can infiltrate that blood-brain barrier and can cause like a lot of neurological inflammation, headaches, migraines, brain fog, memory issues, attention issues, irritability, mood changes, anger outbursts, right? So it's kind of crazy to think that there's a whole ecosystem in the gut that actually influences who we become in terms of our temperament and demeanor as an individual, right? Kind of crazy. Some things that I will share with you just to help reinforce this connection between the gut and the brain. I was all about like studies and statistics this week because I want, number one, I just like a little change of pace. But two, I think it helps because it's like real valid research, not just me coming in, tooting my horn and it's like, oh yeah, of course she says food in the gut because she works with the food in the gut. I'm like, no, I work with food in the gut because I've seen how much success it can provide for my patients as well. So fun fact, one course of antibiotics. First off, how many courses of antibiotics have you probably taken in your lifetime? You can probably name a few you can remember and probably a few you don't even remember. But we've seen how one course of antibiotics can increase the risk of anxiety or depression by about 20%. One course of antibiotics, and multiple courses can increase the risk to almost 50%. So if that's not a connection between the mind, body, and the gut brain, then I don't know what is, right? We also found through a meta-analysis that was done in 2020, 39% of people that are diagnosed with irritable bowel syndrome or IBS also have anxiety. And we find that those that are diagnosed with IBS have anxiety at 3 times the rate of non-IBS participants. Okay, right? It's like, obviously we see this correlation. Again, is it like the IBS contributing to the anxiety contributing to IBS? It really doesn't matter. For some people, it's probably a little bit of both, because don't tell me if you feel chronically bloated, always have to know where the bathroom's at, go 5 days without pooping, or have like a massive like bathroom episodes every time you eat. Like, don't tell me that doesn't cause some anxiety, or struggle with even leaving your house or knowing how to travel well, right? Of course there's going to be some of that, but I think it's interesting how we see such a strong, like 3 times the amount of correlation of someone that has IBS to non-IBS. They're 3 times more likely to have anxiety. That to me is very statistically significant. And if you're a longtime follower of the Lowdown or these Learn with Flo episodes, we have talked about IBS in the past. So there's definitely past episodes about IBS. And we know even then, like take it one layer deep, how IBS is a lot of times misdiagnosed as a very treatable and controllable condition called SIBO, or small intestinal bacterial overgrowth, right? So it's like, not only is IBS 3 times more likely to coincide with anxiety, but also IBS is not this lifelong diagnosis that you just have to live with. There's a lot of people that are actually successfully treating and reversing IBS by getting connected with functional medicine, and individuals like myself that understand what some of those underlying characteristics of that are. So talk to me about like moving through some of these disease labels, we can do that, right? And there's even like interesting studies, like I'll probably get a slap on the hand for things like this because it's just like so out there, but I don't care. There's even some interesting studies coming out that are finding similar bacterial profiles in individuals that struggle with various mental health conditions, right? So let's take, for example, like autism spectrum disorder, right? ASD. Individuals that are struggling somewhere on the autism spectrum are finding a specific colonization of candida. And it can increase autistic behaviors in children by preventing the proper absorption of carbohydrates and minerals, allowing toxins to build up in the bloodstream, right? So it's like, that's interesting how we're finding, like, again, are we coming out and saying that there's a causation between candida and autism? No, we don't have enough data around that yet. But how intriguing and interesting is that to see the similarities of gut profiles from individuals that are struggling with similar mental health conditions. And there's research out there to confirm other things too, whether it's bipolar or ADD, ADHD, anxiety, depression. It's like we're studying, like, what does the gut look like of these individuals? Are there some common themes? Are there some things that we want to bring to light to work this into our holistic treatment strategy, right? So I always believe in a tailored approach for each individual patient. I also want patients to feel educated. I want them to feel like they're in the driver's seat of their care and their treatment. I just want patients and providers alike knowing how to consider their symptoms in like a broader systems-based thinking of the hormone hierarchy and really bringing the body and the brain back together as a whole to have key success. So if this is something that's interesting to you, if you have some of, like I said, you haven't really experienced more of an integrative approach to mental health conditions, and maybe you're someone that personally struggles, or you know somebody that struggles, or maybe you're a provider that wants to be able to expand your knowledge and expand your toolbox, I would encourage you, like, first stop Master Your Metabolism Masterclass. That is going to teach you a lot of the foundational pieces around the nutrition side of things that helps reduce all of these risks and higher instances of some of these mental health conditions, whether it's anxiety, depression. It's going to teach you things about how to eat in a way to balance your blood sugar, how to ensure you're getting proper nutrient density in your diet. What does it look like to actually think about the difference between, processed and ultra processed food? What does that line look like? How do I navigate that, right? So Master Your Metabolism Masterclass is a huge resource for all of that I would encourage anybody to stop there first. You can click the link in my profile. You can start the Master Your Metabolism Masterclass at your own pace at any time. So I would jump into that first and foremost. Individuals that are looking for a little bit more one-on-one work together or digging into some more of these gut and gut influences, I got you. You can, again, go to the link in my profile and click on our functional wellness consult, and you can get started with that at any point in time. That will open the door to us having some more individualized work together. So that's your first step. If you're curious, sign up for a functional wellness consult and we can get that rock and rolling for you. So hopefully these conversations were eye-opening for you and more of this integrative health model, and we'll be back next Monday for more learning.